Hi, welcome to the second night of AMSA's National Primary Care Week. We're thrilled for you to be here right now. We are going to be having Dr. Alan Lockwood present about coal and health, the past, present, and future. Just to give you a little background information, Dr. Lockwood is an emeritus professor of neurology at the University of Buffalo and a member of the board of directors. He's also a senior scientist at Physicians for Social Responsibility. We will be having him present first, and then we will have a question and answer session afterward. There are a few ways to do this. There is a question and answer panel if you want to type in a question there, and we'll address it at the end. You can also put it in the chat box if you would like, and I will look at it, and then we will address that in the end. Without further ado, here is Dr. Lockwood.
Well, thank you very much. I'm very pleased to have the opportunity to speak to you all. As you can see, hopefully you'll see the first slide up on your screen, and hopefully you're coming in through your web browser. For those of you who are interested in learning more about this topic, I'm showing the cover of my still relatively recent book called The Silent Epidemic, Coal and the Hidden Threat to Health. This is available through your local bookstore, or you can buy it through Amazon or directly from MIT Press. I really encourage people to use their independent bookstores or go to MIT Press. Any royalties from the sale go directly to Physicians for Social Responsibility, so I'm not getting rich off of this by any shot. So those of you who are used to seeing CME type presentations will recognize this screen. Nothing to declare. I'm not being paid vast sums by the coal companies to talk to you tonight. And any book royalties are donated to Physicians for Social Responsibility. So I'm going to be talking to you for about 40 or 45 minutes about coal in today's society. I'll put a huge emphasis on health effects of coal's life cycle, talking about mining, transport of coal on railways. The really most important parts have to do with the burning of coal, as you might well imagine. But there's also a significant aspect to the impact that coal is having on health in terms of the waste disposal of or coal ash disposal. I'll emphasize coal and the hazardous air pollutants that are caused by burning coal, also referred to as HAPs, and spend a good deal of time talking about oxides of sulfur and nitrogen. These are two of what the Environmental Protection Agency refers to as criteria pollutants because they have important health effects, and the agency establishes national ambient air quality standards for them. And they make major contributions in terms of being risk factors for the development of heart disease, cancer, respiratory disease, and stroke, the 4 leading causes of death in the United States. I'll talk a bit about the air of the future, the role that carbon dioxide is having, large amounts of being produced by burning coal, and ozone. Some of you may have seen that last week the Environmental Protection Agency released a new ambient air quality standard for ozone, lowering it a bit, not as much as many of us would have liked, but better than what it was before. And then I'll talk a bit about so-called climate interventions, or in a less precise term, climate engineering, and the role that clean coal might have in climate interventions. Then we'll have plenty of time for talking and answering questions afterwards. Well, as I was preparing this talk, this cartoon was published in the Buffalo News, and I'm sure in a bunch of newspapers all over the country, showing Pope Francis at bat using his shepherd's crook, facing down big coal in the World Series of the Environment. Tom Tolles used to be the editorial cartoonist for the Buffalo News. Now he works for the Washington Post and is nationally syndicated. The relationship between air pollution produced by coal-fired power plants and health was, when it was initiated in part by this figure, this diagram from the National Academy of Sciences publication called The Hidden Costs of Energy, which was published in 2009. And when you get your power bill, you pay for the electricity that you utilize, but what you don't pay for are all of the costs in terms of healthcare that are produced by the hazardous air pollutants and the other so-called hidden costs of energy, which drive up the cost of the real cost of energy quite a lot. You pay for those in your taxes that support Medicare and Medicaid, your insurance premiums for health insurance, and so on and so forth. So by usual accounting measures, these ought to be included in the real cost of doing business, which is burning coal to generate electricity. So the National Academy of Sciences looked at 406 coal-fired power plants and concluded in what's now regarded as a very conservative underestimate of the real cost of $62 billion per year for these coal-fired power plants. And hopefully what you see on the slide is a clustering of these coal-fired power plants along the Ohio River Valley and along the eastern seaboard. There are lots of coal-fired power plants in the west, but they're newer and more modern, have better pollution control devices on them, and therefore don't emit quite as many hazardous air pollutants. So that's a bill of about 146, rounded off to $150 million per year per power plant. Not an insignificant amount of money. So with that as sort of an introduction as to some of the hidden costs of energy, let me just address some of the specific health effects. And these are the ones that have to do with mining coal. And the red bars in this figure that you see on the center of this slide represent the prevalence of Coalworkers Pneumoconiosis, or so-called black lung disease, in mines that employ fewer than 50 individuals per mine. This is getting to be a larger and larger fraction of the total number of mines because of the huge amount of industrialization and mechanization of the coal industry that's going on. So that the major factor that's driving unemployment in the coal industry is not Obama's so-called war on coal. It's the fact that coal mine owners are using more and more machines to do the jobs that men and women used to do, mainly men. So in 1969, the federal government passed legislation that limited the pollutants that were present in the mines. And you see in the decade between the 70s and the 80s, the prevalence of black lung disease fell quite a lot. But as the regulations began to be, one, deliberately avoided, and two, not enforced very well, the prevalence of black lung disease began to rise, particularly in these smaller mines, which, as I said before, account for more and more of the mines that are currently in operation. These data from this group that used to be in West Virginia show that you don't have to be a coal miner to have adverse health effects from being near a mine. So what these investigators did was to survey residents of Virginia, West Virginia, and they found that as the amount of coal produced in states, the health status of the residents of these counties rose, and the rates of cardiopulmonary disease, lung diseases, not just black lung disease, but other cardiovascular disease, diabetes, and kidney disease worsened. We'll look at a specific example from that study, the result for chronic obstructive pulmonary disease. If you lived in a county where less than 4 million tons of coal were mined, there was no increased risk for developing this debilitating lung disease. But if you lived in a county where more than 4 million tons were mined, the risk for developing COPD increased by about almost 55 to 56%. So where you live counts. Now, most of coal in the United States is either burned right on the site where the mine is located immediately adjacent to the power plant. Really, it's the other way around. They build the power plant next to the mine. Or it's moved from the mine site to a power plant. And in the U.S., about 70% of all rail traffic is related to moving coal from one point to the other. This is 70% in terms of total tonnage of freight that's moved. And it turns out that rail accidents are much more common per ton-mile of freight hauled than truck traffic. And in addition to the risks of derailments and accidents that I'll show you in a moment, diesel locomotives that pull these trains also emit diesel exhaust particles, and we know increasingly that these particles are harmful to health, particularly those that are produced by diesel engines. And finally, trucks also produce particulates from the diesel engines, as well as the wear and tear on the roads. So moving coal around is bad for the health. It was particularly bad for the 2 women who were killed when this train jumped tracks in 2012. And you can see the freight cars that are off the tracks and those 3 guys standing there looking at the results of this accident. Now, in some cities like Omaha, Nebraska, that I happened to visit a couple of years ago, more than 30 of these trains pass through town every single day, and they are often a mile in length or more. And one of the things that it does, aside from having dust from the coal train go off into the surround, is that it cuts towns in half, so that emergency and first responders may have difficulty moving from one part of the town to the other if a mile-long freight train is moving and they can't go from point A to point B. So that's another potential problem that's associated that people don't think about very much. Now, we mine and burn almost 1 billion tons of coal in the United States every year, and although that's the amount that's being used to generate electricity is going down from around 50 now down to around 40%, there's still one whale of a lot of coal that's burned each year. 1 billion tons of coal is a lot of coal. And about 10% of that coal by weight is ash and doesn't burn in the boilers of the coal-fired power plants. So this produces about 100 million tons of coal combustion waste or coal ash every year. Now, one of the ironies in this business, and there are a lot of them, is that as air pollution control devices that are required to reduce the hazardous air pollutants that go into the environment, as these control devices become more efficient, more of the hazardous air pollutants that used to go out into the air that we all breathe gets trapped in the ash. So the ash is becoming more and more toxic. And it includes already large amounts of heavy metals like arsenic, beryllium, and others, including chromium. The chromium-6 was made famous by Aaron Brockovich, if you've ever seen that film. There's a lot of these nickel and others and lead, including some radioactive elements like uranium and thorium that are also present in coal and find their way into either the ash or the flue gas. Now, at the present time, coal ash is poorly regulated and stored under poor and suboptimum conditions. As you can imagine, if we have 100 million tons of coal ash every year, it has to go somewhere. And in days gone by, these repositories were commonly unlined and not covered. So as rain falls on them, it leaches the heavy metals out of the ash into the groundwater underneath these repositories for coal ash. And commonly, or sometimes, these heavy metals like arsenic find their way into municipal drinking water supplies. And in some cases, the water no longer meets EPA standards for drinking water and has to be shut off. So that these heavy metals and arsenic leak into the water supply and pose yet another threat to the health of individuals that are exposed to these groundwater containing coal ash toxins. Now, many of you, or some of you at least, will remember that in 2008, just before Christmas, in Kingston, Tennessee, a dam that was holding back an 84-acre lake that consisted of water and coal ash slurry failed, and over 1 billion gallons of this sludge escaped out into the surrounding countryside and into 2 rivers that form drinking water supply to people who live downstream. It's typical for power plants, particularly those that burn coal, to be located near rivers because for many of them, they depend on barge traffic to deliver the coal, and they need large amounts of water to cool the equipment that's part of the power plant. So that's not an uncommon situation where, as seen in this aerial view of the Kingston power plant, these ash repositories are immediately adjacent to important water supplies. Now, as they say, the rubber really hits the road when we begin to talk about air pollutants. As I mentioned before, the EPA has identified 6 air pollutants as so-called criteria air pollutants. These are the ones that the agency deems to be the most harmful to health and the environment. And for each of them, there's a National Ambient Air Quality Standard, or NAQ, that's associated with them. And the ones that are of most concern in terms of coal and burning coal are oxides of nitrogen, particulate matter, and I'll have more to say about those, ozone, and sulfur dioxide. Mercury is not one of the ambient air quality standards, but as I'm sure many of you know or are learning in your medical school classes, mercury is toxic to the brain. Mercury escapes through the exhaust of coal-fired power plants, falls to the ground and into waterways, where it's converted into methyl mercury, which is easily taken up by fish, small fish, or even by bigger fish, and substantial amounts of mercury are accumulated, particularly in the very large fish, and can reach concentrations that are 1 million times higher than they are in the water in which the fish used to swim. If you eat those fish, you can be exposed to sufficient amounts of mercury. If you're a woman of childbearing age, they produce a baby that will have diminished IQ as a result of mercury poisoning. So that's a major concern. But I won't have anything more to say about that unless we come back to that in the Q&A period afterwards. But I'm going to focus on these 4 criteria pollutants that are shown in red. Now, these are just a few of more than 60 hazardous air pollutants that are released by burning coal. This was done as a result of EPA's research done where they went to a bunch of coal-fired power plants and sampled the exhaust gases that were coming out of them and tallied up the results. So there are oxides of sulfur and nitrogen, arsenic. Have any of you seen or play or the movie Arsenic and Old Lace? Beryllium, cadmium, chromium, mercury, nickel, hydrochloric acid, hydrofluoric acid, crinoline dioxins, perhaps the most toxic molecule or class of molecules that we know of, formaldehyde, and also small amounts of uranium and thorium, which are 2 naturally occurring radioactive elements. As I said before, these hazardous air pollutants are linked in numerous reports in the epidemiological literature that have been published in leading medical journals like the New England Journal of Medicine, American Journal of Public Health, Lancet, all of the top-tier journals that you are all becoming increasingly familiar with. Heart disease caused 600,000 deaths in the United States in 2013. That's the most recent year that we have data available for. Malignant neoplasms, not just lung cancers, but all of them, 584,000. Arsenic is a risk factor for lung cancer. Respiratory disease, asthma, emphysema, bronchitis, and lung cancer. It makes sense that respiratory diseases would be included as an important class of disease that are caused by inhaling these airborne air pollutants. Stroke, I'm a neurologist, as you heard before, and so I have more than a small amount of interest in the relationships between air pollution and stroke. That's the fourth leading cause of death in the United States. And there's beginning to be evidence that some of the other important causes of death in the U.S., like diabetes, particularly type 2 diabetes, and Alzheimer's disease, and other neurodegenerative disorders, are beginning to be linked to air pollutants of the type that come from burning coal. You won't see burning coal or being exposed to air pollutants from burning coal on a death certificate any more than you will see smoking cigarettes on a death certificate. That doesn't mean that it's not important. It certainly is. Now, as science has gotten better and better, what used to be limited measurements of air pollutants made by ground-based monitoring stations, which are still the mainstay of measuring air pollutants. Many of these are now capable of being measured using satellite technology. And this is a map of particulate concentrations in the United States between the years of 2001 and 2006 that were derived from satellite data. And now other pollutants like carbon monoxide and ozone can also be measured using satellite technology. But the mainstay of these is ground-based monitoring stations. And if you go to a website called EnviroFlash, run by EPA, you can look up the air quality index in your own city, most likely, or certainly in an adjacent city, and see on a day-to-day basis what the quality of the air is. Those are largely determined by the concentrations of ozone and particulate matter. So if you remember back to the slide that I showed you early on in the presentation as to where the coal-fired power plants are located, here's where the same high concentration of particulate matter is also found. Those aren't the only factors that produce particulates, or the only sources, but they're certainly an important one that needs to be taken into consideration. Now, ambient particulate matter has a very complex pathophysiology, and there won't be a quiz on this, but here's a figure that shows some of these important pathways. So if we start off with ambient particulate matter, and ironically, it's the smallest of these particles, the ones that are less than 2.5 millionths of a meter in diameter, that are the most damaging to health. And the reason for that is that when you inhale them, they go deep into the lungs, into the alveoli, where they cause damage, as opposed to being filtered out in the upper airways, where they're much less likely to cause trouble. So some of these, interestingly, penetrate through the first cranial nerve, the olfactory nerve, through nerves that penetrate the cribriform plate at the base of the brain and enter into the brain directly. And you can see these in electron micrographs of the brains, particularly people who live in highly polluted areas. And in the brain, these particles are linked to the formation of some of the same pathological features that are seen in patients with Alzheimer's disease. They activate microglia, they increase the formation of amyloid plaques, damage DNA, and cause neural inflammation. And in the lungs, they do a couple of other things. They cause oxidative stress and inflammation. They can enter the blood and circulate to other parts of the body through the vascular system. The inflammatory changes lead to the generation of atherosclerotic plaques. They stimulate reflex arcs that originate in the lungs that alter the behavior of the autonomic nervous system, leading to changes in blood pressure, heart rate, and other changes in the vascular system. They have effects on the rheology of blood flow in terms of blood viscosity. So these small particles that enter the lungs have many, many pathophysiological effects throughout the body. And that's why, as science has gotten better and better at looking at the effects of particulate matter, the problems associated with them are greater and greater. Now, particulate matter is particularly well linked to cardiovascular diseases, and this has been shown in a number of studies that have been published in the New England Journal, the American Journal of Respiratory Care, Circulation, and three of them I will talk about in just a little bit of detail. The Harvard Six Cities study, which is still going on, showed that there was a 26% increase in all-cause mortality in the most versus the least polluted cities that were included in their investigation. The American Cancer Society Cancer Prevention study showed that for each 10 micrograms per cubic meter increase in particulate matter, there was a 4% increase in all-cause and a 5% increase in cardiovascular, cardiopulmonary mortality. And other studies have shown that there are increases in acute myocardial infarcts, discharges of implanted defibrillators that are placed in patients who are at risk for developing fatal cardiac arrhythmias, and myocardial ischemia during stress tests. All of these show up and can be linked to particulate matter concentration in the environment, sometimes using some ingenious techniques that are now becoming increasingly commonplace in epidemiological research. I'll have a bit more to say about that in a minute or two. Now, as I said before, I'm a neurologist, so I'm particularly interested in the relationships between air pollution and stroke. Now, studies from Korea and Taiwan both show that the risk of ischemic stroke is increased in association with suspended particulates, oxides of nitrogen, sulfur, carbon monoxide, and ozone. And one of the studies that I'm particularly fond of, because a great deal of that work was done here in Buffalo, New York, was the Women's Health Initiative, which studied over 60,000 postmenopausal women who were enrolled at a time when they had no evidence of cardiovascular disease and then followed for about 6 years on average. So this was a prospectively done study, so the quality of the data are very good. And they found, the investigators in this study found that an increase of 10 micrograms per cubic meter of particulate matter of the smallest type was associated with a 24% increase in the risk for a cardiovascular event and an increase in the risk for a cerebrovascular event. Now, I mentioned that epidemiological research is getting better and better, and this is one of the studies published in 2012 that is a good example of that. Again, looking at stroke risk and particulate matter concentration. Now, as I said before, there are air quality monitoring stations all over the place now. There's several of them in the Buffalo area. Every major metropolitan city in the United States has multiple air quality monitoring stations. And now these stations churn out these concentration data on about an hourly basis. Now, as you have or will learn in your clinical years, that it's very important when you're evaluating a stroke patient in the emergency room to try to determine when the onset of symptoms of the stroke occurred, because that determines the ability to offer different forms of treatment to patients. So this group of investigators that published their data in the Archives of Internal Medicine correlated the onset of stroke symptomatology with data from air quality monitoring stations. So two completely disparate sources of information, one clinical and one environmental in nature. And they found that if there was a peak in the concentration of small particles 10 to 12 hours later, that individual was at an increased risk for developing a cerebrovascular event. So this kind of work has also been done with defibrillator discharges. Again, a peak in air pollutants is a risk factor for the sudden discharge of a implanted defibrillator. And again, those are events that can be determined with a high degree of precision, as well as increasing numbers of other kinds of events where the time course is determined with some degree of precision. I alluded to a bit earlier in the talk to the Clean Air Act, which in my judgment is one of the major public health triumphs of the last 50 years. And it's through the Clean Air Act that the EPA sets air quality standards, particularly for the 6 criteria air pollutants. And in 1990, during the administration of the first President Bush, the so-called acid rain amendments were made to the Clean Air Act. And these, for the first time, controlled the emissions of oxides of sulfur and nitrogen from coal-fired power plants. And as you see from this figure, the red bars show the annual emissions in millions of tons for sulfur dioxide, and in green for oxides of nitrogen. And both of those have gone down by almost 50% as a result of the acid rain program. Now, oxides of sulfur and nitrogen are both important in and of themselves because they're irritants. If you inhale them, it's going to affect your pulmonary system. But the oxides of sulfur in particular are very, very chemically active, and they combine with other elements that are present in the atmosphere to form these very small particles. So oxides of sulfur are bad in and of themselves, and they're bad because they're precursors to the formation of the small particles that, as we get smarter and smarter, we know they're more and more dangerous. Oxides of nitrogen I'll have a bit more to say about in a moment because that's a precursor to ground level ozone, which is an important trigger for exacerbations of asthma and other forms of respiratory disease. Now let me switch gears here just a little bit and talk a bit about climate change and the role that greenhouse gases, particularly carbon dioxide, play in producing climate change. This figure from one of the intergovernmental panels on climate change shows the concentration of the 3 most important greenhouse gases since over the last 2,000 years or so. And actually the records for these greenhouse gases concentrations goes back more than 800,000 years and has come from an examination of air bubbles that are trapped in the ice in Antarctica. But what's shown here in this figure is that at the beginning of the industrial age, which is right about 1750, 1800, the concentration of these gases in the atmosphere began to soar. And before this time, before the industrial age, the highest concentration that carbon dioxide reached in the last 800,000 years was less than 300 parts per million. And now it's over 400 parts per million. And there's very good evidence that shows that this is the result of human activity, particularly burning fossil fuels. This graph shows, which came from globalcarbonatlas.org, and sometime if you want to have some fun playing around with some of these data, you can go to this website, globalcarbonatlas.org. Shows the emission in tons per year of carbon dioxide by the 5 BRIC countries, plus the United States. The United States is shown here in blue, and our CO2 emissions have started to go down a little bit from a baseline of around 2005, 2006. China, on the other hand, at about the same time, began to have a huge increase in carbon dioxide emissions as their industrial economy revved up and they brought online, on average, a new coal-fired power plant once a week. India, Russian Federation, and Brazil all produce substantial amounts of carbon dioxide, and each of these countries now has made a commitment to reduce CO2 emissions as a run-up to the Paris Conference on Climate Change that'll begin at the end of November and the first week or so in December. Important but small steps that are pledged in an attempt to control the emission of this important greenhouse gas. And one of the most effective ways of doing this is to limit the emissions that come from coal-fired power plants. And that's the crux of President Obama's Clean Power Plan, which was announced by the Environmental Protection Agency, and I predict will be the source of intense conflict in Congress of the United States among those who are supportive of the Clean Power Plan as a path to sustainable energy economies in the future, and those who think that climate change is a hoax. Now, this figure comes from the Institute for Sustainable Development, and they have put together a number of scenarios that show how leading countries like the United States and China and Britain can reduce their carbon dioxide emissions from burning fossil fuels in the future. And a somewhat busy graph here shows that the energy use by various sectors is around 12 exajoules per year in the United States, and will almost double by 2050. And these will be largely due to increases in industrial use of electricity and the use in buildings. The use by the transportation industry is not projected to grow very much. There aren't very many electric cars out on the road yet. But one way to attack this problem is through so-called decarbonization. And one of the strategies that's proposed for doing this is to implement so-called carbon capture and storage technology. And you'll hear a lot about this being proposed by the coal industry, and I'll tell you why in a few moments. But this figure here shows that a path to decarbonization of the United States energy could involve complete phase out of burning coal without carbon capture and storage by 2050. Use of natural gas, including natural gas with carbon capture and storage technology, some increase in nuclear power, a bit of an increase in hydroelectric power, large increases in wind power, and some increases in solar energy. So this figure shows that by the year 2050, carbon dioxide emissions in the United States could be reduced substantially by implementing these technologies. If there's a political will to do this and sufficient efforts in terms of research and development are made. So let me talk, since carbon capture and storage plays such an important role in this pathway to decarbonization, let me say just a bit about that. So here's a couple of figures from the Intergovernmental Panel on Climate Change Carbon Capture and Storage Report from 2005. We have these central places shown on the left of the slide where CO2 is produced. The first step in this is so-called capturing carbon dioxide. Now, when you hear that the police have captured a suspect, you would imagine somebody in jail or at least in handcuffs so they can't get away. Not so with carbon dioxide. Carbon capture in this jargon means that an exhaust stream that's very highly concentrated in CO2 has been produced. That's absolutely nothing to do with controlling it, which is the second important step in this pathway. and the one that takes an enormous amount of energy. Some people have estimated that somewhere between 30 and 40% of the energy in a power plant would go into the carbon capture and storage technology. So the CO2-rich exhaust stream would be compressed. The CO2 would be liquefied, sent by pipelines that don't exist to places where it would be stored by some technology that's yet to be proven, and stored basically forever, like it was a long-lived radioisotope. Because if this carbon dioxide ever escaped back into the atmosphere, it would have negated the effect of doing it in the first place and caused problems. So one of the strategies for for storing this carbon dioxide is to inject it into wells, as shown in these wells over here on the left-hand side of the figure. But in places where liquids are being injected into wells, there's a huge increase in the number of earthquakes in those states. So these are data that are taken from Oklahoma. It shows the number of earthquakes of Richter force 3 or greater occurring per year. And these are data from the Oklahoma Geological Survey and the United States Geological Survey. Just when deep well injection of hydraulic fracturing liquids really began to take off, was in around 2008. So they went from having 0 to 3 earthquakes per year to now, in the year 2015, the estimates are around 950 or so earthquakes. This led the state of Ohio, where similar things were happening, to ban deep well injections. So this may not be such a great way of getting rid of these liquid carbon dioxide. So the elements of carbon capture and storage to review are production of a waste stream with a high CO2 content. That's the capture, compression and liquefaction of the CO2, transport to the disposal site by a pipeline, hasn't been built, and disposal in perpetuity. And all of these are now in a research stage and are worth more investigation, but the efficiency with which this is likely to work is somewhere between estimated 80 to 90%. And this may not be good enough to get rid of the amount of carbon dioxide that we need to get rid of in order to keep dangerous levels of climate change from occurring. Plus, CCS involves, burning 40% more coal, which the coal companies really like, so that they're backing this sort of myth of clean coal, because if this takes off, they're going to mine and sell even more than the trillion tons of coal that's already being consumed in the United States each year. So this is still an experimental stage. It's not going to be 100% effective, and that may not be enough to protect us from climate change. Let me switch gears again here and look at the fate of the oxides of nitrogen that are emitted by power plants and also internal combustion engines. Oxides of nitrogen are a precursor to the formation of ground-level ozone. And this is a projection of what seems likely to happen in some of the major cities in the eastern part of the United States, where ozone levels are projected to rise to the greatest degree. And these purple circles are where estimates in ozone concentration will go up by 12 or more % by 2050, assuming that nothing else happens other than climate continues to warm. So the ozone standard that's being set as of last week of 70 parts per billion may not be sufficient in the future, because it's likely to go up by 10 or more % in many of the major cities in the United States, like Cleveland, Ohio, Chicago, Illinois, Detroit, Michigan, where there are large numbers of people living. So the ozone of the future may be higher, and ozone levels go up, asthma rates go up, stroke rates go up. Now this is a more detailed look at where ozone comes from. Over on the right-hand side of this, you see ozone, which is also a greenhouse gas, is produced by a series of very complicated atmospheric chemical reactions that involve volatile organic compounds, some of which are released as the result of human activity. Plants give off some of these volatile organic compounds, including isoprene. There are estimates that some 600 million tons of isoprene are injected into the atmosphere every year by plants. And these enter into these VOC, HOX, NOx cycle that produces ozone that causes people with asthma to have increased attacks. So the atmospheric chemistry behind all of this is really quite complicated. But one of the bottom lines is that as temperatures go up, the amount of sunlight that reaches the Earth goes up. Those are the sources of energy that drive these chemical reactions that form this ozone that's present in the troposphere, the lowest level of the atmosphere. This is the air we breathe. Now, it's important to differentiate this from stratospheric ozone, which is good. Ozone up high is bad, nearby. Ozone up high is good, nearby is bad. This stratospheric ozone blocks ultraviolet rays from the sun and protects us from cataracts, skin cancer, and enables plants to form our crops that we rely on, enables them to grow. Now, Wall Street is hedging its bet on coal, and these two graphs show the value of stock of two of the largest coal companies over the last few years. And you can see Arch Coal and Peabody Energy prices of their stock have plummeted because the handwriting is on the wall. Coal is on its way out. We still burn and mine enormous amounts, but natural gas is coming onto the market, particularly from hydraulic fracturing. That's the subject of another talk. And four of the very largest coal companies went belly up in the last couple of years. Alpha Natural Resources, which bought Massey Energy for $7.1 billion, is one of those. So the handwriting is on the wall. Wall Street is betting against coal, and for good reason. Now, one of the other provisions of the Clean Air Act, and we're coming down a home stretch here, is a requirement on the part of the EPA to publish cost-benefit analyses of the provisions of the Clean Air Act. And these are data from the most recent of these cost-benefit analyses. And the estimate is that by the year 2020, the Clean Air Act will result in savings in the healthcare realm, which is very broadly defined, including missed days at work, not just people who aren't dying of heart attacks and stroke and cancer and so on and so forth. They factor in all of the elements of health. Those benefits will reach somewhat close to $2 trillion per year in terms of their benefit at a cost of around $65 billion. Now, $65 billion is not a trivial amount of money, but it's the people who are forking over the $65 billion who have the loudest voices and are paying for the attacks on the Environmental Protection Agency and its efforts to provide what I refer to as protections for health via the Clean Air Act. So the Clean Air Act, is one of the reasons why I mentioned earlier before that I think that the Clean Air Act is one of the most important public health measures that we're likely to see in this half century. So what do we need to do to move to a more sustainable energy future? Well, clearly we need to improve energy efficiency. This is the low-hanging fruit. You don't have to generate any more electricity, burn any more coal, any more other fossil fuels like natural gas to get the same bang for the amount of electricity that's produced if you use it more efficiently. we need to use more and more renewable sources of energy like wind and solar. Photovoltaic energy here in Buffalo. Elon Musk's company is building what will be the largest photovoltaic cell manufacturing plant in the Western Hemisphere here in Buffalo. It will employ around 1,200 people. There are more people working in the sustainable energy field now than in the coal mining industry. So it's not a it's creating different jobs and new jobs as we move in this direction. Sun-powered boilers and some of the forms of sustainable energy that depend on energy from the sun, like artificial photosynthesis and hydrolysis of water to generate hydrogen that can be stored and used at times when the sun's not shining. It's not very hard to store hydrogen. And if we're able to transform things that are laboratory curiosities now, like solar-powered hydrolysis of water, that splits water into molecules of oxygen and hydrogen into something that is available on an industrial scale, these now experimental curiosities will become increasingly and perhaps the most important sources of energy that we use. Over 10,000 times as much energy comes to the Earth in the United States every year as we consume in terms of electricity. We need to take more advantage of that. Here in Buffalo, where I live, we generate 80% or more of the electricity that we use in our home with a photovoltaic array on the roof of our house, even though it, as you may have heard, rumors to this effect, it occasionally snows in Buffalo, and when there's 6 inches of snow on our PV array, it doesn't generate any electricity. Almost 80 times as much energy as we use is available in the form of wind energy. And this is the wind belt across the midwestern portion of the United States. Already in the state of Iowa, almost 30% of the energy that they consume in the form of electricity is produced by wind energy. And as you drive down the interstate there, you see farms of windmills. You see them on the shores of Lake Erie here in Buffalo. You see them on ridges in the Appalachian Mountains in Pennsylvania, where we travel quite frequently. This is an example of one of those PV arrays. There's a catalyst added to the cell. It's illuminated by artificial sunlight. Oxygen comes off of one side, hydrogen comes off on the other. This is potentially the key to the future. So everyone can do something to move to a sustainable energy future. And there are those of us in the medical field that it's a part of our professional responsibility to use the information that we learn in our training as physicians and during our practicing years as healthcare professionals to make this a better world in which to live. You can ask your candidates if they support EPA's clean air and carbon dioxide emission standards. Both of these are important health-based issues that the American public is facing. Speak to your friends, family, and colleagues about the importance of clean air and how that will protect your health. And join and support organizations like Physicians for Social Responsibility and others that are working to promote public health. So thank you for tuning in this evening. It was a privilege to be able to talk to you. These are some of the things that we're doing in our home in Buffalo. We have a 4,400 watt PV array on our roof. We drive energy efficient automobiles. And we're replacing our compact fluorescents, which contain mercury, with lead emitting diodes. So be happy to answer or try to answer any questions you might have. And thanks again for your attention.
Thank you so much, Dr. Lockwood. We're going to be opening this up now to a Q&A. If anyone has any questions, please, you can bring it up in the chat box or you can bring it up in the Q&A box. We do have one question to start off with, and that was, with the U.S. Preventative Task Service Force and other organizations making recommendations for screening, there are not any screening recommendations for patients who have exposure to chemicals such as coal that can cause lung disease and cancer unless they're already symptomatic. So, you know, there's no screening we can really do unless they're already symptomatic. What would you recommend primary care physicians do when they have patients who may have an increased risk for lung disease due to coal exposure or other chemical exposure?
I think there are two things that you can do. I've met a couple of people when I was in Fairbanks, Alaska, a couple of years ago on a book tour after the publication of the Silent Epidemic. I met a woman who owned a home that was right across the street from a coal-fired power plant. And she and her family moved and she says that her health improved as a result of that. Perhaps the other things that you can do are less tangible than, not doing something that is as drastic, and that is to put on your public health hat and be an advocate for improved energy efficiency, for climate change, adaptive measures in the city that you live in, so that the need for electricity goes down, and there is an improved ability to adapt to things. You can also go to the EnviroFlash website that I mentioned before, ENVIRO Flash, and if you click on your city, you'll see what the air quality index for that particular day and that particular hour is. And those are warnings that are published by the EPA that advise people, depending upon what the air quality index shows, whether or not they should be staying indoors where air quality is generally higher, ozone concentrations and particulate concentrations are lower. But, you have to be able to go outside sometimes, so that there are short-term and long-term things that can be thought of. But in terms of screening techniques, I'm not sure that that there are any that make any sense.
Okay. We have another question, and so a lot of us as future physicians, or if we're current physicians, will work in an area where, coal mining is still prevalent, or some type of fracking or some type of chemical degradation of the earth. So how can we as physicians be an advocate for environmental health and, ending these processes without alienating our patient base? Because a lot of them, this is a source for their job.
Well, that's really a tricky issue. And let me point to the example in the state of Washington, where various stakeholders got together and they sat down and they all talked. The union people who had good jobs in the coal-fired power plant, the company that owned the power plant, and stakeholders that lived in the community that surrounded it. And they worked out a strategy for moving the people from their jobs in industry into other good-paying jobs. So they were happy. The people who owned the power plant were faced with mounting costs that were becoming prohibitive, and they couldn't afford to run the plant. So, shutting it down anyway was likely to occur. Coal miners, there are as I said before, there are jobs. There are more jobs now in the solar industry than there are in the coal mining industry. So that people who have skilled and unskilled jobs are trainable to do the kinds of work that was necessary to install the photovoltaic array that perches on our roof. This is, it was an electrician who did this work, but a lot of it, involved climbing up a ladder and drilling holes in the roof and, running screws into the joists and sealing them up. The electrician had to wire it all up, but there are jobs in this industry that are becoming more and more prevalent. I mentioned the 1,200 employee factory that's being built in Buffalo. It's estimated that another 1,200 to 1,400 jobs will be created in Buffalo as a result of the support industries that are necessary to provide groceries for these workers, clothing, and stuff like that. The things that you need for everyday life. So that I think the responsible thing to do is to sit down and open up a dialogue with the people who are affected and institute the kinds of transition programs that are necessary to move people from dangerous, bad jobs. I mean, I wouldn't want to be a coal miner, into jobs that are healthier for the individual who's doing the job and healthier for the planet and the people who live around them.
Okay, thank you. It looks like that's it for our questions tonight. So I just wanted to give a big thank you to Dr. Lockwood for this presentation, and thank you for all of those who attended the webinar or are currently listening to it later. Thank you.
Okay, good night, everyone.